7:31 in Trinidad and Tobago, keeping that focus on health and wellness. And indeed, Monday was World Mental Health Day. We highlighted that. Today is World Sight Day. And here to give us some valuable tips is Dr. Ronnie Bhola, CEO and consultant ophthalmologist with CVRS and Trinidad Eye Hospital. I should mention again, because I don't like to let this pass, he's also a 9-time Skeletrix champion, bringing back the good old days. But we were all fans of Skeletrix model car racing. But we're talking about Blindness Awareness Month as well. It's also being observed in this month of October, and that is why we have invited Dr. Bhola to join us once again to rev up his Skeletrix engine to give us some guidelines when it comes to eye health. Good to see you once again, Dr. Bhola.
Thank you for having me, Fazir. I want to become a 9-time champion on the TV6 morning show.
All right. Well, who knows? You might have your chance. The more we talk about these issues related to eye and eye health, what point would you like to bring across this morning on a day like today?
Well, today is a very special day, and it's really a day where we focus on the eye health of people, and we really want people to start prioritizing their eyes. You know, when we think of your 5 senses, definitely 9 out of 10 people will tell us that their eyes is the most important of the 5 senses. And when people compare it to, their finances and everything else, nobody wants to lose their eyes. They want to preserve their eyes. And if you want to preserve your eyes, then what you should do is take care of your eyes. Make sure you think about the things you need to do to keep the eye healthy, And what I would want people to do today on World Sight Day is to do that. Think about the things that you could do, simple things to make your eyes and keep them healthy, because you want to keep your eyesight for the rest of your life seeing really well. So you want to get your eyes tested when the time comes, when people, non-diabetic people who don't have any problems, every 2 years is recommended. And if you're diabetic, then you get it tested every year. You get your eyes looked at. Make sure nothing happened in there that we need to prevent problems from. And, make sure you wear your shades when you go out. Really simple things. Eat healthy foods, all those little things. We want people to start thinking eye health.
And as far as that is concerned, because, we always say prevention is better than cure. But, and we've had this discussion with yourself and other medical professionals before. People lead such busy lives. They prioritize other things than their own health, their own well-being, and so on. And often with very tragic consequences that you could finally, when you see your eye getting blurry, cloudy, you're not seeing clearly, then you decide to go. By that time, it might be, if not totally too late, there's so much damage done already. And therefore, how would you like to get that message across to our viewers who might be saying, look, I know my eyes are important, I know I would like to see to the end of my days, but I just don't have the time to go and do this eye checkup?
That's such a important thing to really think about. When there was a study done in Trinidad that looked at diseases, and in the over 40 population, the most common disease that was picked up in eyes was glaucoma. 1 in 10, we think, people within the over 40 population may be suffering with glaucoma, and 9 out of 10 of them wouldn't know. And the problem with glaucoma is it's irreversible blindness if left untreated. So it's really important as you age, you're getting older, that you go and get your eyes screened. Now, to screen for glaucoma, or get your eyes looked at for glaucoma, the opticians, optometrists, all the eye care professionals will check your eye pressures and look at your nerves in the eye. And then they will decide if you have this thing. And so it's really important that you get your eyes tested, because things could be going on in those eyes that you need to start taking action for, because you don't want to lose your eyesight. The other thing is, there's a non-diabetic aging population. What about the people who have diabetes? Well, they're a special group. They could get other problems like bleeding in the eyes and other things. And we could prevent that. Prevention, as you say, is really the goal to get your eyes healthy for long.
And Dr. Bhola, what would you say, though, to anyone who might be saying, look, I hear you on that, but I dragged my tail a little too long, I waited too long, and you know, I haven't had the chance. Should we be looking for any indicators? Tired eyes, blurriness, any sort of discomfort or anything? I mean, you don't want to get to that level, but are there any actual indicators that, look, maybe you need to get this thing checked out?
Yeah, so one of the issues with waiting for symptoms is that some of the conditions could cause permanent blindness if not checked by a professional. So even if you think, well, I don't have symptoms, you still need to get checked. That's the key point. But some diseases do give you reduced vision, and they are warning signs. So if you happen to be diabetic and you start to see floaters, hey, that's a bad sign. It means you could be having bleeding in the eyes, and you need to get that looked at quickly, because it could lead to another problem, which is something called a retinal detachment. That's really serious. And that's where I get involved, because I do this retinal surgery and I see these patients with their retinal detachments. If they came in when they got the first sign, which is the floaters in the eye, a little bit of reduced vision. So if you're a diabetic and you start to see that reducing vision, a little bit of floaters, it's a warning sign for zero. They have to come in. If you notice floaters in the eyes and you're not diabetic, we need to check to see if you have another problem, like a retinal detachment, a tear in the retina, which we could seal.
And you said floaters, just for those who might not understand what it is you're talking about. When you say I see floaters, what are we talking about here?
So this is, a floater is pathologically, I'll just be a little medical here, is when the gel in the eye, the vitreous humor, which is behind the lens in front of the retina, which is at the back of the eye, that jelly thing that moves in the eye, starts to get particles in it, and it starts to move in front of your retina and cast a little shadow on the back, and you start to see it moving. It looks to people like, they describe it, most people describe it like little spider webs in your vision, and they're just moving, and you're thinking, well, what is that? And some people take their hand and they're trying to, you know, it's in front, I think it's somewhere here. And then they realize it's not in the air, it's actually in their vision, in their eye. And that's what they typically describe as the floaters.
Okay, I'm glad we were able to clarify that for those who might be wondering exactly what we're talking about. So in the couple of minutes that we have available, Doc, and we really thank you for taking the time to be with us this morning on this World Sight Day, because as you said, when you think of your eyesight, it's so fundamental to us going about our daily lives and enjoying life in any way, shape or form. What is your ultimate message? What is the message that you like to make sure that you get across to everyone who's following our show this morning?
Yeah, I want you today on World Sight Day to think about how special your eyes are. And, you know, we ran a study looking at people who thought about, you know, they wanted a $500,000, some wanted $5 million, but would they give up their eyes for that? That's how important your eye is. It's more important than all the money you might make, you know, in your lifetime. So if your eyes are that important, at least get it checked. Get it checked by a professional, because you want to make sure that these stay with you for life, because they are more valuable than all the money you could make in time going forward.
And for people like myself who tend to be rather lazy when it comes to doing these things, Doc, I did one in 2020, and I was pleasantly surprised to know that my eyesight hadn't deteriorated since the time previously. So I get kind of cocky and arrogant with it, and then I'm saying, well, okay, I'm doing well, and I haven't checked it since. At the age of 57, should I have done a test sometime this year already?
Yeah, I think every 2 years you should get the eyes looked at. You know, like you're fit, strong. You don't really need to be seen yearly. I would say, you know, I would like to see like you. I want you to close your eyes every 20 minutes and just rest them, re-lubricate the eyes, relax the muscles. So I'm going to be looking at your program every day and making sure I see you close the eyes for 20 seconds every 20 minutes. Give them a little rest, because you want to have them for long.
Dr. Bhola, we want to thank you very much indeed for taking the time. And by the way, for those who might like to reach out to CVRS, Trinidad Eye Hospital, are you able to provide the contact information as well if they want to make an appointment, if they want to do some sort of counseling, some sort of advice on eye health? Would you care to give us that information as well, please?
Yes, yes. You look us up. We were on Instagram, Facebook, and we on the website. Just Google Trinidad Eye Hospital and you'll pick us up. Get all the
Dr. Ronnie
numbers you need.
We thank you very much indeed. So we will see if you'll become a 9-time champion eventually of Morning Edition. You already give me some homework of closing my eyes every 20 minutes. Some people say I should close my mouth most of the time on Morning Edition, but still we have to do what we have to do. Thanks very much for taking the time to be with us this morning.
Thank you.
You're more than welcome. 7:41 coming out was 7:42 in Trinidad and Tobago. Let's head to another break and let's take an image of the sunset that is going to be sent to us from our viewer. That's Shanice Charles with this beautiful sunset that she sent to us. Very nice colors indeed as we go to the break.